Thank you very much, Madam Deputy Speaker, and thank you through you to Mr Speaker himself for granting what is a very special adjournment debate on the launch of the HIV Commission, falling as it does on this World AIDS Day. I'm very grateful. World AIDS Day is a campaigning moment. You know, it's a day when we wear a red ribbon, and on this World AIDS Day when we launch the final report from the HIV Commission. And that's very much how I viewed it when I was the Public Health Minister. But actually, World AIDS Day is a day of remembrance and reflection. Terry Higgins, who obviously gave his name to the Terence Higgins Trust, was of course one of the first people in the UK to die of an AIDS-related illness. He was just 37 years of age in July 1982, just across the bridge from here in St Thomas's Hospital. And of course he was to be followed by many more. So we remember today not just someone whose name is well known and synonymous with the fight, not the rock star who made Live Aid what it was, but the dad, the mum, the son, the daughter, the brother, the sister, the partner, who we will never know, but those they left behind certainly did. And we pay tribute to the activists, the HIV activists, many who are still with us, too many who are not, that have never given up in their pursuit of better treatment for HIV, maybe one day a cure, an end to new transmissions, improved services, and the fight against the dreaded HIV stigma, which still persists. So I think the best way we can honour all of these people, Madam Deputy Speaker, is to refocus our efforts and end new cases of HIV by 2030. And it just so happens, Madam Deputy Speaker, that today we have a plan to do just that. So, in 1986, I was 1 year into secondary school when AIDS touched down, and no one can forget seeing the tombstone advert, never mind the iceberg version, which was actually more scary, of the Don't Die of Ignorance campaign, and the raspy, menacing voiceover provided by the wonderful John Hurt. And I just want, if I may, to read out the opening words of that TV commercial. It said this, it said, "There is now a danger that has become a threat to us all. It is a deadly disease and there is no known cure. Anyone can get it, man or woman. So far, it's been confined to small groups, but it's spreading." Sound familiar? You know, back in 1986, AIDS seemed to be a threat which would overwhelm us. Also familiar. And those words of John Hurt that I read out, and those adverts, terrified a nation. And they were meant to. I would argue the most successful public health message in our history, until perhaps stay at home, protect the NHS, save lives. So fast forward 30 years, and I find myself, much to my surprise, the Public Health Minister, with the opportunity to put what has become scientifically possible, ending new cases of HIV by 2030, into policy. And when we first proposed the idea to my right honourable friend, the Secretary of State, who I am deeply touched is here himself to respond to this debate on today of all days, I have to say, when we proposed it to him, it was not a tough sell. We'd already done so much as a country, meeting the UN AIDS 90-90-90 targets on testing, treatment and suppression early. And, you know, the Secretary of State understands prevention is better than cure more than most. So it was terrific to watch him tell the AIDS-Free Cities Global Forum in London in January 2019 that this government would set itself the ambitious, but we think wholly achievable goal of today's Commission. And just as Lord Fowler in 1986, then Secretary of State for Health and Social Security, of course, rejected a moral crusade against the way of life in favour of a practical plan to fight a virus, so we, in creating the HIV Commission, turned the possible into policy and the policy into this practical plan. And I want to pay tribute to Damien Gabriel, who chaired the Commission with a firm hand and great style, as well as the Honourable Member for Ilford on the other benches, and the 8 other commissioners who put so much into producing what we launched this morning with the help, wearing a fabulous jacket, if I may say, of Sir Elton John. Also, the three CEOs that have made this possible: Ian Green of Terence Higgins Trust, Deborah Gold of the National AIDS Trust, and Anne Aslett of the Elton John AIDS Foundation. Thank you so much. And to many, including the chair of the all-party group I see here, and my honourable friend, the member for Finchley and Golders Green, who can't speak this evening, have done so much to assist us in this journey. And I would say that the prize is clear. England could be the first country to end new cases of HIV, and we can help the world do the same. Of course.
I'm really grateful to the honourable member for giving way. It has been such a privilege being a member of the Independent HIV Commission, not least because of the wide range of people that we've met and engaged with during the course of our work that have helped us to put together a concrete action plan that could help us, if we get this right, to end HIV transmissions by 2030. That is such an enormous prize, and I want to join my honourable friend on the government benches in thanking everyone who took part in the Commission, and the Chair, Inga Beale, in particular, for her wonderful leadership. But if I may also say from these benches, Madam Deputy Speaker, I want to thank the Secretary of State for Health for being here this evening, for responding to the debate. We've seen great cross-party leadership from him, from the Leader of the Opposition, the Leader of my party, and therein lies the hope that with joined-up political leadership locally and nationally, we will turn this report not just into a worthy piece of work, but a concrete plan of action that changes people's lives and changes the course of history.
I bless my honourable friend for that. I mean, it has been a pleasure to work with him on the commission. And, you know, when you're asked to do something like that, and he has had a front bench responsibilities himself, you know, it's a big commitment, actually. And I think we had to be sure that it was a commitment that was going to lead to something proper and something realistic and something deliverable. And I don't think we could have asked for better in the plan that has been produced. And the cross-party element of this is so important. There's no room for an inch of partisanship in the all-party group for HIV and AIDS in this particular fight, because whatever happens at the 2024 general election, we need this. We can't reset after the next general election if there should be a change of administration. We need to keep up the focus and keep working across this House. I give way to the chair of the all-party group.
I thank the honourable member for giving way, and can I absolutely commend his work and leadership on this, not only as a minister but as a member of the Commission, indeed my honourable friend, and also to the Secretary of State, and indeed to the health ministers and the devolved administrations as well, my own colleague Vaughan Gethin, the health minister in Wales, because it's only with leadership on this issue and cross-party working and cross-UK working that we're going to get to that crucial target of zero infections by 2030. But would you agree with me that, as on so many public health issues, this is a global fight as well, and that our continued support as a country for things like the UN Global Fund are crucial to getting to that 2030 target globally as well as in this country?
Yeah, I most certainly would. And actually, you know, when I travelled around the world as a health minister to G7, G20 meetings, the NHS, as the health secretary has said many times, and what we do within it is so well respected around the world, and we often set the tone and set the lead. And so, yes, this is a plan for England, but I hope that it will work across the devolved nations for the UK, and I hope that we will set the standard around the world, as we have in so many areas of public health policy, that others will then follow us from. So I take his point exactly, and I will give way to my humble friend from Strangford.
Thank you very much, Madam Deputy Speaker. First of all, can I congratulate the honourable gentleman for Winchester bringing this forward. I just want to add my support for the project of the HIV Commission, which has been brought forward. And I just also want to, I spoke to him beforehand, and I think it's important, Madam Deputy Speaker, that we put on record the hard work that has went in. But there are many people in my constituency of Strangford. One of the churches, the Enum Church, they have a missions. And one of the things they've done is helping to address the HIV in Swaziland. And the wonderful thing out of that, over the period of years that I know them and what they've done, they've been instrumental in assisting the Swazi government to reduce down to 27% the number of adults who have HIV from 50%. So a programme of education, a programme of medical support has helped. And would the honourable gentleman agree that perhaps what they have done in Swaziland could enable us through the House of Commons here to deliver that for the rest of the world as well? Thank you.
Yes, I mean, the faith element of this is very important because we have done very well on driving down the numbers, but we've got to do even better, and it's going to get harder as we get closer to the goal. And Reverend Steve Chalk, who was a Baptist minister and a founder of something called the Oasis Charitable Trust, was one of our commissioners, and he gave a very important element to this, and I think that the point the Honourable Gentleman makes is very valid. So let me just carry on and conclude, Madam Deputy Speaker. So why do I say that this is scientifically possible? So obviously, while an HIV diagnosis is notification of a serious condition, these days it is not the death sentence. It once was, thank goodness, and many understand it to be. An end is therefore in sight. I mean, treatment has come such a long way. So people on the right treatment have their viral loads suppressed, meaning someone cannot pass on HIV. This, frankly, was a game changer. Overwhelmingly, people in England and the UK now know their HIV status. Of the 106,000 people with HIV in our country today, 94% know they are HIV positive. 98% are on treatment, and nearly all of those are virally suppressed and therefore cannot pass it on. In addition, we have a wonder drug, PrEP, taken by people who are HIV negative, and it stops transmission during sexual intercourse. So the PrEP impact trial data comes out in the new year, but we know already it is a massive success, and I hope I'm proved right with that assertion. My right honourable friend on the front bench made the drug readily available, free on the NHS. That was important, and while that took a little longer than it might, and legal challenges notwithstanding, let's not dwell on old ground. Just let's ensure that all communities that can benefit from it know about its virtues and know about its availability. If we're to get the benefits of PrEP to all who need it, HIV testing is needed in GP surgeries, in pharmacies, and even mentioning such, I refer the House to my register of interests, termination clinics and gender clinics, and much more besides. And then PrEP prescribing powers need to be given to each of these bodies. Again, it can be done, we just need the will to do it. I commend the PrEP Protects campaign, focused on black African women and men. If we can get take-up in other communities, as there have been in the gay and bisexual men, we are changing lives and we are saving money. So thank you to the Terence Higgins Trust, the National AIDS, I Want PrEP Now, who lobbied me heavily as a minister, and Prepster for their amazing campaigns on the issue. And then very briefly, I will just give way.
Thank him very much for giving way. Does he commend the efforts of community groups who are going out and selling that message to their own communities as well, such as those who work for Waverley Care in Glasgow and the Hoop and Winu Health and Wellbeing Project, who are making sure that that message gets out into the community?
Absolutely. The big society groups have been so important to the work of this commission. We've heard from many of them, and I know they're very important north of the border, so I thank her for putting them on the record. So with the cavalry, that's the science in place. With the policy agreed, we needed this practical plan. So for 18 months, the Commission has met, it's listened, it's learned, it's deliberated, and our recommendations are clear. So I'll just close with a few of them. One, let's get new instances and the number of people undiagnosed down by 80% by 2025. This is the first benchmark. While most of these will be in communities we already work with to reduce HIV transmissions, the last 20% most likely do not, and they will be hard to find, but the rewards will be great. Secondly, we want ministers to report to Parliament annually on the 2025 target and the 2030 goal. This will focus minds and track progress. To make these kinds of advances, we need the promised HIV action plan in very short order. And thirdly, HIV testing, this is the crucial bit. HIV testing must become normalised in the system. No longer should 250,000 people go to a sexual health clinic and not be offered a test. But we must go so much further. When you present at A&E, when you register with a GP, the NHS or otherwise is taking blood, and an HIV test must be carried out. So not opt-in, but opt-out. The default assumption is that it will happen. And we know that that can happen. Maternity services have shown it's possible. Midwives test in non-judgmental settings pregnant women for HIV, and there's a 99% take-up and therefore near zero vertical transmissions to newborn babies. And this could be the same elsewhere if we get this right, but there are many challenges to do that. The funding is with local government, the testing needs to happen in primary care, as well as secondary, but it's all possible with political will. In short, Madam Deputy Speaker, it's a policy of test, test, test. And if ever there was a time when we can successfully land that message, it is surely at the end of this ghastly 2020. So underneath these recommendations lies a 20-point action plan to bring all of this to life. I think rarely has a commission been presented with such an implementation-friendly set of actions. If the government is minded, and it has one or two other things on its plate right now, it could do a lot worse than copy and paste our findings into the first draft of this aforementioned HIV action plan. Each action is assessed for its impact on health inequalities and its contribution to fighting stigma. It looks to everyone who is and could be affected by HIV, and that was important to us. And we're not denying that some of this will require investment, but I think it's investment worth making because, bluntly, it will change and save lives, and we've shown how to do that after the government asked us to. And if the moral case doesn't persuade people listening to this debate, hard cash might. Modelling by the Elton John AIDS Foundation found over £200,000 in future healthcare costs was saved per person who was diagnosed and linked into the right treatment and care. So, not unlike the dynamic we face in cancer care, early diagnosis is the magic key in HIV as well. And finally, to the wider sector, I say this. I hope we've done you proud in our work with the HIV Commission. You got us here. We now need to come together to get this done. And to my colleagues who are in the House tonight and listening elsewhere, who will join us in campaigning for exactly what we're asking, I say many thanks in advance. We will be in contact. So, Madam Deputy Speaker, we could end HIV transmission on our watch. How amazing would that be to that 12-year-old schoolboy and many others who saw that advert in 1986? Let's not pass up the opportunity, and with this man as Secretary of State, I don't think we will. Thank you very much.
Secretary of State.